It's Great Day Houston. From food, fun, health, family, in other words, your life. It's your morning wake-up call to everything Houston. And here's your host, Deborah Duncan.
Hello, everybody. Welcome to Great Day. Thank you very much. It is all about your health today. Our medical professionals are in, so if you have a health-related question, email it to greatdayhouston@khou.com, and they'll address your concerns throughout the show. Our panel for this Medical Monday are cardiologist Dr. Coda J. Reddy, emergency medicine and anti-age specialist Dr. Richard Laconi, pharmacist Gina Eubank, gastroenterologist Dr. Owen Mott, and facial plastic surgeon Dr. Benjamin Salento. Please welcome them to the show today. Okay, it's been said that if you're going to get sick or have any kind of issues at all health-wise, Houston is the best place in the world to be. All right, but when it comes to modern medicine, the prediction is that relatively soon it won't be uncommon to see someone celebrate their, I think you told me, 150th birthday?
It's getting close to that, yeah.
Oh, wow. Okay. Well, that's really amazing when you consider that the average global lifespan in 1900 was about 30 years old, in the United States a little bit higher. So how many of you would be dead by now if that was still the case, if 30 was the cutoff? How many of you I'd be in the ground? All right, so we lost a lot of our audience now. Okay. Well, our longer lifespan is obviously directly related to investments in medicine. And we want to do a little experiment right now to see how many of us would not be here if we were born at a different time. So everyone in the audience, stand up. Okay. So how many of you have ever had cancer or known someone who's had cancer? All right, sit down. Okay. So you're gonna represent those other people too. Okay. Well, how many of you have diabetes? Okay. So you're sitting down. All right. So how many of you have ever had a surgery of any kind? Yeah, surgery of any kind. Could be a C-section, anything. Okay, so half of you sit down because, of course, when you have surgeries, back in the day, the problem was infection, wasn't it? Yes. Okay.
That's right.
All right. Well, the rest of us were left to fight off epidemics, plagues, and childbirth. Just strep throat. Do you ever have strep throat? Oh, sit down. Oh. Okay, we lost everybody. All right. That was then, this is now, so we want to talk about what's happening in the future that will add years to our lives. Okay, so several of those things we mentioned seem just so common today. Now, obviously, certain things can cause death, but something as simple as strep throat. Like, what would have happened before the days of... Yeah, because penicillin's only been relatively...
Right.
Something that we have used. Okay, let's talk about things that we are looking forward to in the future. Diseases that were contained in the 20th century by vaccinations, which are very important, obviously smallpox, measles, influenza, but the future of vaccines.
The future of vaccines, it's just amazing. One of them that's coming out that just blew my mind is for addiction and abuse. And what their plan is that when somebody uses that, that drug will not cross the blood-brain barrier, so they don't get the high at all. So you can vaccinate them. The way it is now, they have where somebody has to take a medication if they're, an alcoholic, and it makes them violently ill. So they have to be compliant. This way, you can give them the vaccine, and they won't even get the high from it.
Wow,
so,
that's amazing.
And of course, cancer vaccines. I mean, that's on the horizon. For brain, breast, lung, kidney. I mean, it's tremendous.
Yes. And at the same time that we're looking at what's like tremendous for the future, what we've been working on research-wise, Dr. Reddy and several doctors, you kind of go back to the way that medicine was when it was more simple. Like, we can talk about things like a cancer vaccine, but then we can also talk about what are you doing to your own health to try and stop something like that.
But along with that, I think the next great frontier would be the stem cells.
Right.
A lot of us don't talk about it as much, but I mean, it's amazing the initial results which you see with stem cells. Patients with scarred heart muscle tissue can be regenerated. Patients with problems with macular degeneration, they're already showing signs of recovery. A lot of situations where patients are incurable, stem cells are coming in and helping out.
Well, and we know that the stem cells have really helped in terms of heart disease, but how widely used is that right now? Is that still...
Right now, it's only a few centers in this country and mostly in Korea. But I think in the next 10 years, everything will open up.
Yeah,
Stem cells
It's also being used in other areas as well. If you look at orthopedics, they're really taking off. And some of those products, although they're off-label uses, They're actually being used for facial plastic surgery and sinus as well. We use stem cells to promote healing inside, make it a much less painful procedure. You shorten the time that you would have spent out of work. So
yeah, and Dr. LeClaire, we say stem cell. What do we mean? What is that cell doing that it hasn't done before for us?
Well, you know, these are cells that really gave rise to all the cells of our body when we were in utero and developing, and now they're throughout our tissues distributed, in a sense, waiting for that moment when you may need them for injury or damage or illness. So these cells need to be simply awakened so that they can rebuild muscle tissue, immune cells, bone, cartilage. Provided a framework, they can even build new organs. And they're doing some of this research where they build bladders. They give us scaffolding, the stem cells cover it, and voila, at the end you have a bladder that, you know, was otherwise destroyed. So they're just beginning to touch. This is all developmental, and we think that it'll start to bear fruit here real soon.
Yeah, yeah, which means it's just a much less aggressive way of going into the body and fixing things.
Uses your own tissue, so there's no rejection. I mean, this is amazing.
Yeah, yeah.
Deborah, one thing to keep in mind is a good source of stem cells is cord blood. When a child is born, you can take a sample of the cord blood and store it. When my daughter was born, we had that done, and there's a vial of her blood sitting in New York City waiting for the day where she might need those stem cells in the future.
Yeah, and that's amazing, because then that's like the cleanest stem cells you can find just about, right?
Right, you're on.
Yeah, yeah, yeah.
Now, I'm going to add something else. History always repeats itself. So stem cells is one frontier. The other thing you should talk about is fasting. They actually were doing a study showing that rats, when they're from birth, when they were fasted every other day, extended their lifespan by 88%. That means a human being can automatically live to 150.
Wow, lengthens your telomeres.
But are we going to look good? That's all I need to know.
That's right.
I just want to make sure that we're going to look good. Okay, we're talking about stem cell. I want to talk a little bit more about something else called blood patching, when you deal with things like wound care.
yeah, not just wound care, but it's completely changed sinus surgery. So it has other applications, and sinus surgery didn't develop it, but it's being used extensively because sinus surgery used to be very difficult to recover from. I didn't like doing sinus surgery on people because you had to wait till they got so sick before you were willing to go through the surgery. Because I have a little prop here, and we used to pack the nose. If you think of your kid's birthday party and you had the clown that pulled all that stuff out of his pocket,
or the silly string that
you'd
went
put
crazy.
3 yards in each nostril
Wow.
of this stinky, smelly stuff, and when you pull it out, it hurts. And so we replaced that actually now by just taking a little vial of your own blood. You spin it down, and you get a lot of products from your own blood that help heal and help clot. And you just spray that into the inside of the nose, and it goes away over the next month or so without having to pull anything out. So you feel a lot better. You don't have this terrible changing of the packing every day that people were terrified of. And I'm still dealing with the fear that a lot of people have had because they have family members that had it done 5-10 years ago, and they couldn't really deal with the pain. But not only that, it has stopped all of the, or at least lessened all of the bleeding complications that we have from sinus surgery. So it's really made it a much more feasible thing to do for minor sinus problems.
Yeah, and it's interesting because that is one of the biggest stumbling blocks people have, is that they remember somebody who had a treatment done yesteryear. All right, the other thing is the personalized medicine, a patient's genetic profile. You know, certainly when it comes to things like colon cancer, one of the things we say is, is there any family history or anything? But that's also very interesting to look at in medicine in terms of giving you a tool to work with.
Absolutely, and you know, there's a trend in the future to get a genetic code for each tumor, and in interpreting that code, pick out the best chemotherapy or radiation.
Right, because all cancers aren't the same.
That's right. So each tumor, it gets a DNA imprint, and you can choose the best therapy based on that.
Yeah, all right. Well, if you have a question about any of the topics we'll discuss today, email us at greatdayhouston@khau.com. Our medical panel is heading off to join you online throughout the show to correspond with you one-on-one about your concerns. Up next, the one thing you can do to absolutely avoid one of the deadliest cancers and the tool doctors now have to make the procedure more foolproof.